I'm honored that you're all here on such an important topic. Vivek, the last time I was with you, I think we were in Aspen and Elmo jumped out of the box and you were talking about vaccinations, but it just occurs to me that, you've been very bold, whether it's on vaccinations or talking about guns, but redefining what social health, emotional health, our society's health is. And you've just written this very provocative piece about loneliness and health. And I'd just like to have you help share with us for a moment how you see the dashboard of loneliness in this country right now.
Well, it's a great question. Let me just say, Steve, it's just great to be with you again. And I want to thank Caremore and The Atlantic for hosting this event today. Sachin and I did have a chance to catch up, and it did make me feel less lonely. So thank you, Sachin. I'll tell you that this is one of the subjects I find most important to talk about. When I was in office and when I had the privilege of serving, I had to engage on many different topics. I worked on Zika and Ebola and the opioid epidemic and a host of other public health issues. But what I found is when I would go out into communities and talk about issues and more importantly, listen to what people cared about, very often behind their stories were stories of loneliness and stories of isolation. And that's what first clued me in to the fact that there was something going on that we needed to address. Now, I found this to be true in communities all across America. It wasn't just urban communities, it was also rural communities. It wasn't just people who defined themselves as liberal or conservative. It was people across the age and political spectrum who seemed to be affected by loneliness. Now, if you want to get a sense of just how broadly this impacts the country, you have to look a bit at the research studies. And I will caveat this by saying that there are a lot of them, and they're often all over the map. They sometimes use different scales to measure loneliness. They sometimes look at different study populations. So it's hard sometimes to do apples to apples comparisons. But what you can see is even if you look at the good studies and at the lower bound, of the range of loneliness that you see, it is in the double-digit percentages of adults who in America who say that they are struggling with loneliness. And if that many say they are struggling with loneliness, I guarantee you the real number is higher. And just by virtue of comparison, consider that we have just under 10% of people in the United States who have diabetes. And you start to realize that loneliness affects far more people than the number of people who have diabetes, the number of people who smoke, and the number of people who are impacted by many other conditions that we put a lot of money into. You might say, well, that's because those are really consequential. When people smoke, they get cancer, they get other illnesses. When they have diabetes, there are serious vascular complications that can come from that can lead to heart attacks. So that's why we have to put money into that. But more and more, the research is telling us that there are real health consequences of loneliness. And some of the studies, including meta-analyses done by Julianne Holt-Lunstad and others, have shown that people who struggle with loneliness have a significantly higher risk of premature death. In fact, their risk of premature death seems to be, their risk of premature mortality is about similar to people who smoke about 15 cigarettes a day. It's greater than people who actually are struggling with obesity. And think about how much money we put into addressing obesity and cigarette smoking. There are reasons for why this may be the case, and I'm happy to share some of those theories with you. But the bottom line is that loneliness affects our health. And social connection can help keep us healthy, not just prevent illness. And this is actually a really important point I want to make. It's not just about preventing diabetes and heart disease. It's about enabling us to be more and to perform more at every stage of our life. There's nobody I know who just wants to be disease-free, right? Or who just wants to be on the opposite edge of having diagnosable illness. We want to be functioning at the top of our game. We want to be fully present when we're with our family. We want to be fully contributing members of society and as highly functioning as we can be. And it turns out that to do that, to optimize our function in life, we have to not only have good physical health, but we have to have good emotional health. And a component of our emotional health is our social connection.
So what is coming undone? I mean, I went through the data, and I have to tell folks, I highly commend his Harvard Business Review article work in the loneliness epidemic. Half of it was so depressing to me. The other half, which we'll get to in a moment, was much more uplifting. But in it, when I read data like rural suicides have increased by 53% in the last 20 years. What in our social gravity is making things worse than they used to be. Because part of this, if this was always this way, that would be one story. If you went back to the Depression era in the 1930s, and we had a certain portion of people that felt disconnected, and we've not budged that. But it just seems to be the pot is getting worse. That Robert Putnam, when he wrote Bowling Alone, was saying there are other things that are happening that are detaching people. And I'm interested in what those macro forces are as you see them.
Sure. Well, I think, every era, I think, has faced its own challenges that have contributed to loneliness. And loneliness has been a problem for quite a long time. We haven't measured it for hundreds of years, but it has certainly been around for a while. But there are modern day forces that I think are making it harder to stay socially connected in a meaningful way. And one of those, I think, has to do with the fact that we are more mobile than we ever used to be. We move from community to community, often for work reasons, and we leave communities behind, including friends and family. The second issue has to do with technology. Now, I don't think that technology is all bad. In fact, I say this as somebody who spent years building a technology company, who uses a lot of technology, who believes in technology. But I think what matters is how we use technology, and we can use technology in ways to connect with others. For example, if you traveled here from New York City and you posted on Facebook or on Twitter to your followers that, hey, I'm coming to DC, would anybody like to get together for dinner after this event? And you end up having dinner with an old friend. That's a great way of using technology to bridge to offline connection. The challenge is when we start using technologies in ways that substitute lower quality connections for higher quality connections. Because having 5,000 friends on Facebook or 10,000 followers on Twitter is not the same as having people who know you authentically, who you can be yourself with. And unfortunately, that substitution often happens. So technology has a role to play here. And then work culture is important too. Partly aided by technology, work now seeps into every part of our lives, into our evenings, our weekends, even our vacation time. And that can come at the cost of quality time that we have with people we love. But I think some of the most insidious factors that contribute to loneliness that are hardest to deal with are actually cultural factors. And what we unfortunately have is I think a culture that has skewed so far toward the individual that it has led people to think that the key to success and to being worthy in your life is to be self-sufficient, meaning to be able to do everything on your own, to not rely on anyone for anything, whether that's support at work or whether that's emotional support. It's to be able to be self-sufficient. And this is a narrative that they give to both men and women, but it turns out that the research shows it gets conveyed to young boys at a particularly young age. That to truly be a man, you have to be self-reliant. You can't need anybody else. And we also, in our culture, we tell people what they need to do to be valuable. And it turns out that to be valued, you have to look a certain way, you have to have certain assets and income, you have to have a certain type of lifestyle. I think about my own kids. I have a 2-year-old son and I have a 10-month-old daughter. And when they grow up, I want them to live in a society where they believe that what they're worth is about who they are, whether they're compassionate, whether they're kind, whether they're generous, not about what kind of car they have, how much they have in their bank account, or whether they have the latest sort of fashion trends, hanging in their closet. But we tell people over and over again through advertising, through other means, that they are not enough, that they are insufficient on their own. And I think this grates at people. And when a little later in this conversation, I want us to get to solutions and talk about how it is that we can actually address the challenges with loneliness, because they trace back to these key elements of not just how do we reconnect with others, but how do we build stronger connections with ourselves? How do we value ourselves more? Because that is the foundation on which our connections with others are actually built.
I want to read the second paragraph of your article, and this is a story of how your family was a victim with so many others of Hurricane Andrew in South Florida in 1992. And it reads, like thousands of others, we survived the storm and the many dark days that followed because of the kindness of strangers who brought food, water, and comfort. Hurricane Andrew forged a deep sense of connection and community in South Florida as the nation rallied around us and we supported each other. But slowly, as normal lives resumed, the distance between people returned. We went back to our homes, our work, our schools, and our lives, and once again we grew apart. That was a very stark image that our normal, where our clutch is not in connecting. It's in moments of crisis or tension or despair or something, that is peaked. And I'm interested in whether our human nature has taken us there, or whether you think that's reversible and that element of empathy, of social concern, is something that can be seriously sustained on a more consistent basis.
Well, that experience of living through Hurricane Andrew was, it certainly was a profound one for me. But what it exposed me to, and I think this is true of many natural disasters that we see, is it exposed me to what people are really like at their core. So at their core, I think people actually are empathetic, they're kind, they're generous. But then things happen to us in our life that lead us to believe we can't be that way. We're told, for example, if we're too kind, people will take advantage of us. We're told that if we don't look out for ourselves enough, then we'll get left behind and other people will take our opportunities. We're told a whole bunch of things that lead us to believe ultimately that our focus should be on the individual and should be on work as opposed to on others and on building community. And what has happened as a result of that is we've built our lives around work and external values as opposed to around people. And I think about that a lot right now because my wife and I are trying to figure out where we should live and what we'd like to do in this next phase of our life. And it's become very clear to us, in part because we have kids, but even just on our own, that we want to and need to live someplace where we prioritize people, whether that's family and being close to them, or whether that's going to be close to close friends, or being in a place where we can make new connections. But we want to build this next phase of our life around people, and we realize that we have been guilty of spending the last several decades building our life around work, often to the detriment of our social connection. But I do think that it is our natural state to be empathic. And when we're in places of extremis, when we're in crisis situations, that tears all of the other layers off, and that exposes who we really are. And you see communities coming together in these extraordinary, beautiful ways. I would love to flip the ratio, like in our lives, and have that be more of our day-to-day experience, so that we can live in the way that I believe we truly evolved to be.
So I want to get to solutions, and I know you actually deployed some of these when you were Surgeon General with your own teams and whatnot, but I want to ask you a different sort of question that may sound unsympathetic, and I'm trying to figure out how to craft this so I don't sound like the dark,
Don't be gentle,
cynical
it's okay.
person. No, I'm trying to sort of go from this. I I can tell by the interest in this room. I can tell by what I've read how serious this is. Is there a way to make it less fuzzy? And what I mean is there a way to talk about action plans or frames or processes that people can do to remedy this, or to frame it in a way that's less fuzzy and just imprecise? Because I'm just interested as a doctor, when you're out there trying to sort of talk about emotional well-being, why can't we find a way that is just more direct? Does that make sense?
Yeah, it totally makes sense. And I think it's an important question to ask because we tend to gravitate toward concrete things that we can get our arms around. And this is true in medicine as well. There's this old sort of tale about a man who's walking down the street one day and he sees another man looking for something under the lamppost. And he pauses and he said, "Sir, did you lose something?" And the guy says, "Well, yeah, I lost my keys, so I'm looking for them." And this guy says, "Well, let me help you find them. Maybe we can find them better together." So they keep looking and they can't find anything. After 5 minutes, he pauses. He says, "Sir, are you sure you lost them around here?" And he says, "No, I lost them over in the bushes." He said, "Well, why are you looking here?" And he said, "Well, this is where the light is." And the reason I share that story is sometimes we go where it's easy to go, where it seems more rational, even though the solution is elsewhere. And in medicine, this happens all the time. As I can say, as someone trained in medicine, I know there are other clinicians who are probably watching this right now. We are taught a lot of algorithms. We are taught, how to, for example, manage and titrate people's blood sugars if they have diabetes, how to manage their blood pressure. We're taught how to manage numbers actually quite well. And so we tend to pay attention to and focus on those things. But sometimes the things that matter most to our patients don't fit neatly in a numerical box. What every doctor and nurse who's cared for patients will tell you is that a patient's will to live is extremely important in their ultimate outcome. They'll tell you that if a patient is profoundly depressed, it's hard for them to really engage in their treatment, regardless of whether they fulfill the criteria for major depressive disorder or not. It is often in the emotional dimensions of our life that we have to deal with the most fuzziness, but where the greatest impact is often had on all the other parts of our life. But when it comes to loneliness, I think there are ways to make it even more concrete. Number one, there are scales that we can use to evaluate whether people are lonely or not. The UCLA, for example, developed a scale that's validated and that's used in quite a large number of research studies, and that certainly helps. But I think that there are also concrete things that we can do to address loneliness, and we can conceptualize them in three major bins. One is steps that we can take to strengthen our connection to the people that we know and love. These are our family and our close friends. The second are things we can do to strengthen our connection to our outer circle. So if our inner circle is close friends and family, our outer circles are the people that we interact with in the world, our neighbors, our coworkers, the strangers that we may meet in the subway or on the street. And the third bucket are things that we can do to strengthen our connection with ourselves. And this matters so much because our connection with ourself, and by that I mean how much we value ourselves and how much we believe in our self-worth, is the foundation on which we build our connection to our inner and outer circles. For the simple reason that if I don't believe that I'm worthy and valuable as a human being, why would I think, Steve, that you would want to spend time with me or have an interest in me? And this is particularly important because of the culture that we live in right now, which is, I think, stripping away the self-esteem of so many people, including our young people, who are made from a very early age to feel that they are not enough. And so there are things we can do in these three buckets. And in the article, I actually talked about one example of this. It was a tool that actually helped strengthen our connections to our outer circles. And it was something we did in the office of the Surgeon General when I was there. Even though we had this great family sort of feel in the office.
This is Inside Scoop?
This is Inside Scoop, yeah. So even though we had this great family feel in the office, we realized that people weren't as connected to each other as they could be. They weren't necessarily feeling bonded to each other in a way that made coming to work feel like coming home. And we felt like that was something we needed to do something about. Now, we tried having happy hours, we tried having weekend picnics, where people could all get together with their families. And there's nothing wrong with those. Those are great. Those are wonderful things to do.
So we can keep those, Margaret. We're using this for us, too. No.
But the one challenge with doing those is they often actually do take a lot of resources. They take a lot of time as well. And what you're often asking the participants to do is to either sacrifice some time with their family, or you're asking them to sacrifice time at work, and sometimes they have to come back and finish up that work later. And sometimes it's worth it, but it's challenging. We decided we would try something even more simple, which was to take 5 minutes once a week during our all-staff meeting and ask one person on the team to take that 5 minutes to show us pictures. And it could be pictures of their choosing, of their life before they were in the office, of their childhood, of their friends, of their aspirations after they left the office. It could be anything they wanted, but just show us pictures in 5 minutes. And that's what they did. And it was an extraordinary thing. Within a very short period of time, and I mean within a couple of weeks, we saw that this meeting quickly became people's favorite meeting of the week. If I tried to reschedule the meeting, there was like holy hell to pay. Nobody wanted to miss this meeting now after we instituted this.
Did you show your pictures?
So I did not, and the reason I did not is because by the time we didn't actually get around to me before my time in office ended. So, but it was fine because we really wanted everyone else in the office, most importantly, to be able to connect with each other. They all had time with me, that was fine, but it was the bonds they built with each other that were our highest priority. And so what we found is not only did people love the exercise, but we started to see that they were feeling more comfortable with each other. People started crossing outside their lane into other people's lanes to help them out when they were struggling. We realized that people were raising their hands more at meetings to participate. People who had never said anything before because now they felt part of this community and more connected to everyone else. That's a simple exercise to do, but it was, for us, 5 minutes. That was perhaps the most important, high-yield 5 minutes in our entire week, and it helped our whole team work a whole lot better.
In a moment, I'm going to go to all of you, and we're going to make a special phone call to someone who's trying to work in the Austin community on this issue, which I'll get to in a minute. But as you are thinking about other strategies, I just want to be candid that the notion of mental health or emotional well-being I know you talk about emotional well-being often gets, conflated as happiness. It's a hard thing to achieve in some communities. And the Atlantic helps produce the Aspen Ideas Festival, and we did a thing on the happiest places in America last year. And Boulder, Colorado, interestingly, comes out as #1. And the mayor there, she said that she felt it was because most people in Boulder felt they had a sense of purpose, something they had a cause for, and then they ride bikes and walk everywhere. And they just said that mobility and activity. So it's sort of an interesting thing when it came to. But not every place is Boulder, and so I'm just as if you were to get a second chance at Surgeon General, returned, what would you prescribe at a level to go in some of the worst and most stressed parts of the community and figure out how they could begin getting back on a track? What are the proactive things people here? We have lots of folks that are multipliers in their communities here and watching. What are some of the other things beyond Inside Scoop that you would consider?
Well, I think that in communities, you need different parts of the community to play a role in ultimately building a really connected community, because our communities are made up of schools, they're made up of workplaces, of local government, of social organizations and nonprofits. And there are things that each of them can do. So workplaces, for example, can start very simply with measuring loneliness in their own workplace. And we're taking simple steps like Inside Scoop to give people opportunities to understand each other as authentic people. People want to be known more than just as Joe who's great at Excel or Mary who's amazing at pricing strategy. Like, they want to be known for who they are. That doesn't mean everyone needs to know everything about you at work, but people need to see the human side of you beyond your skill set. Schools can actually start to look at how they can build social and emotional learning into their curricula. And nonprofit organizations can actually, particularly focusing on youth, can look to some amazing programs that have already been built around the country as ways to bring young people together. And I'll give you an example of those. In Chicago, there's a great program called the Becoming a Man program. And some of you may have heard of this program. It's known for its role in reducing violent arrests among at-risk young men. And it's a simple program that brings small groups of young men together with a facilitator, and once a week they talk. And they talk about a whole range of issues, and the facilitator helps them get to deeper issues and to start sharing about the stuff that really matters to them, whether it's their relationships with family or concerns they're having with their safety. And it takes time to build up to that. But what they found was, in a study conducted through the University of Chicago Crime Lab, that in 1 year, when compared to a control school, that the students who participated in this program once a week for some 30-odd weeks had a 44% reduction in violent arrests compared to the other group. And when I spoke to the founder of that program and I said, what's the real active ingredient here? Is it that you're teaching them skills of conflict resolution and then de-escalation? And he laughed, actually. He said, no. He said the number 1, 2, and 3 reason why this program works is because we're addressing loneliness among these kids. We're giving them an opportunity to build trusted connections with each other. But you know what the truth is? It's not just these young at-risk men who are struggling with loneliness, but it is people all across the age spectrum. When I was doing a radio program with Iowa NPR some months ago, people called in at the end, and there was a man in his 40s who called in, and he said, my best friend died 2 or 3 years ago, and I felt profoundly lonely since then, but as a guy, I feel like I can't say that, and I'm not sure what to do. I had a woman who called in whose daughter had just gone to her first semester in college, and she said, my daughter came back for the holidays, and she said to me, Mom, I'm texting with people all the time, and we're messaging each other all the time, but nobody really knows who I am, and I feel so alone. And she was crying, and she was telling me this story. She said, I sent my baby to school to be a part of a community, and I never thought she would feel so profoundly alone. And so there are these steps that our institutions can take, but local government, one of the most powerful things it can do is to simply acknowledge that social connection matters and that addressing loneliness is a priority, and to set the stage for bringing together these other sectors, employers and healthcare systems and schools and social institutions like the YMCA to actually develop and be a part of a strategy to create a more connected community. There are mayors who have done this. Anaheim is one city. There are others, say Louisville, Kentucky. The mayor of Anaheim actually ran on a platform of making Anaheim a more compassionate, connected community. He thought he'd be laughed off the stage. He won his election actually by a fair margin. There are ways to do this, and I think the sooner we put our loneliness on the agenda as an urgent priority, I think the happier and the healthier we'll be.
We're going to take a quick moment and make a phone call to a friend of mine, Tom Gimbel. So go ahead and place the call. Tom, if many of you don't know, runs Austin City Limits, and he's in Austin, and he and his wife, Courtney Blanton, have created something I'm just impressed with. It's called the Hi, How Are You Project, and it came out of his relationship with a musician, Daniel Johnston, who's had his own struggles and triumphs, and they wanted to basically deal with the stigma of mental health and getting more community stakeholders to reach out to people who may be alone. So this just was complete coincidence. I happened to be emailing him today, and I said, wait. Even we have to add a few more minutes to this, we're going to give you a call because he's going to try to put together the Live Aid version of a big music festival, if you will, on January 22nd in, next year in focusing on this question of how to reach out to people. Have we reached our friend? Hello.
I'm here.
Tom, hey, how are you? So we're on with Vivek. We've got a room full of people and even broader in the country on C-SPAN listening. I've just shared with them a bit of what you and Courtney have done with the Hi, How Are You project in Austin and broadly, and I wanted to give you an opportunity to ask, to make a very quick comment and ask Vivek a question. Say hi.
Well, I appreciate the opportunity. It's an honor. Yeah, as you mentioned, what we're trying to do is encourage people to say, hi, how are you on January 22nd? And I really appreciate what Dr. Jane said in his opening remarks about reaching out and calling a loved one. That's really what Hi, How Are You is all about. It came about from Courtney's personal struggles with mental health and depression and, of course, my experience with Daniel Johnston over the last 30 years. So what we decided to do is use the entertainment industry to break through and reach people, especially young people, and encourage a very simple message, which is on this day, reach out, say hi, how are you to somebody, and really mean it. Reach out to someone who's a coworker, a family member, or loved one, and have a real conversation. And there's catharsis, and there's power, and there's healing in that. So that is the purpose of Hi, How Are You Day on January 22nd. It's going to be a live streaming concert event, and as you mentioned, we want it to be a Live Aid moment for mental health. So many of my questions have been answered as I've been listening here on the phone, but one for Dr. Murthy is, it appears to me that in Western medicine, that often the first course of treatment is a prescription drug. And as it pertains to loneliness and to mental health, do you feel that there are other treatments and therapies that should be recommended first?
Well, that's such a great question. Tom, first, let me thank you for the amazing work that you and your partner are doing in building this initiative. I think we underestimate the power of simple things like looking people in the eye and saying hello. Interesting study done on eye contact that showed that when people experience eye contact from someone else who's walking down the street, a stranger, it actually improves and measurably changes their feelings around loneliness. It decreases their loneliness. I mean, that's how powerful simply making eye contact can be. So I love what you are doing. In terms of doctors,
Thank you.
what we do, it's so interesting. I think back to our training and what we learned about the history of medicine. And we often used to say that, 50, 60 years ago, before we had medicines like beta blockers and other heart medicines to give patients, when somebody had a heart attack and they came in, they would often just sit in the hospital for weeks while people observed them. And we used to say, gosh, things are much better now and our outcomes are better. Now, the medicines are important and they work. And if I had a patient or a family member who was ill, I would want them to get medicines that are proven to work. But what I worry has been left behind is that time that we actually spent with the patient and recognizing that itself is actually therapeutic in its own way. That when people feel that there's somebody they trust, someone who's looking out for them, that it makes a real difference in their healing. And so my hope is that we can get back to that piece of medicine, that we can reclaim that part of the doctor-patient relationship, because I think it's essential if we want people to be healthy.
Thank you very much. Thank you, Tom. Now let me get all of you. Questions, comments here, thoughts. Don't be shy. Right here in the front. Yes, ma'am.
My name is Paula Gordon, and I have a website called GordonDrugAbusePrevention.com. One of my major areas of concern right now is marijuana and how it is being used so widely and leading many of the chronic users to chronic depression and suicidal depression and increasing numbers of suicides. And in fact, there's a Code Red series of videos that can be found on YouTube. Dr. Somerville, Steve Somerville, from one of the hospitals there, said that the suicides that they have seen, that around 90% of them have THC in their systems. And I think this is something that we really have to pay a lot of attention
Thoughts
to.
on what clearly is, even the greater legal use of marijuana, but thoughts on that and the question of isolation and also health.
Yeah, so specifically about marijuana, I've been concerned just about how rapidly states have been legalizing marijuana for recreational use. And here's the reason why, and even for medical use. And the reason is that I actually don't think that we have nearly as good data as people think we do on how to use marijuana for medical purposes. If you have back pain, for example, and you go for a prescription for medical marijuana, how's a practitioner supposed to know how much to give you, for what duration of time, what interactions to look out for? There's a lot of unknowns here, and I think that we have overestimated how much we actually know and have not been cautious enough. But more broadly with drugs, I actually think that this is very much connected to issues around loneliness and social connection, because social connection is essential for our emotional well-being. When our emotional well-being is depleted, we experience that as a void in our lives. And as human beings, we will seek to fill that void to avoid the pain. The question is, what do we fill the void with when we're in deep pain? We may fill it with friends, if we're fortunate enough to have friends. But what if we don't have people around us? Well, then we may reach for something else, and that could be alcohol. It could be drugs, it could be violence, it could be self-harm. It could be a number of things that are ultimately destructive to ourselves and to others. So I think as we think about the opioid epidemic, for example, and other issues around substance use and substance use disorders, we have to recognize that if we do not address the emotional well-being of people in our country, we will not get a handle on the issues that we are facing with drugs. We will not be able to address the opioid epidemic if we are not addressing emotional well-being. And I think that's essential for us to know. That's why investing in social connection is, I think, one of the important strategies for ultimately addressing our drug epidemic.
Yes, right back here. Hi.
I'm Kitty Shidana from the National League of Cities. So I particularly appreciated your comment, Dr. Murthy, on local leadership, local mayors and governance, as well as the comments about measurement, right? Is this too soft
Right.
and fuzzy? And so I'm wondering, there seems to be two parts I'd love to hear you thoughts about. One is that very often on the fuzzy things, we need stories, right? Stories to inspire more leadership. And then in terms of what's measurable, there are things that are probably measurable that we're not all as aware of. So would love to hear.
So before you take the mic away, can I just ask you, does the National League of Cities have any resources itself? Are you folks thinking about this topic amongst your own member cities?
We are not focusing on this topic specifically, but one of the things that crossed my mind is that true community engagement is such a vital part of good plans for cities, and it's a vital part of equity, of narrowing disparities. And to the extent there's real connectedness and civic connectedness in the communities, it also it helps the city's progress as a whole, and also I think in many ways address some of the issues that this forum is about.
So this is going to be your wrap up here. So make it good.
Well, so I think we do have tools for measuring. The question is, we have to prioritize measuring and include measures of loneliness in the surveys and studies that we're already doing. But I think if we look closely, we'll see that there are stories, in growing number of stories, of how this is actually happening. I mean, we heard from Dr. Jain about some of CareMore's efforts that Robin is heading up. To me, that's a bold example of an organization that, even in the face, of a lack of data and research in the field, is saying, you know what, a lack of data is not a reason to be inactive and just to sit on our heels and wait. But we need to move forward, we need to try things, and we need to study them and see whether they're working or not. So I think there are a growing number of stories like that. But I think that local leaders are essential because they can help set the table, that other people come and join. They can make this a priority issue. And there is something very powerful about naming the issue of loneliness that helps people feel that you see them in a way that's deeper than how they're often being felt before. One of my great concerns when I was Surgeon General is I realized very quickly that we have so many amazing citizens in our country who are walking around feeling invisible, not seen, not known, not heard by the people around them. And they lead lonely lives as a result of that. And that takes a toll. It affects how they show up at work and in school and in their communities. And finally, I just wanted to say that when it comes to addressing loneliness, it can get complicated. There's 10,000 things that you might think that you could do. But I try to think about 3 very simple things that I can do in my own life and that I suggest to others as well to address these 3 boxes of connection to our inner circle, our outer circle, and ourselves. But I find that when it comes to connecting with our inner circle, that being present is what matters. Spending just 5 minutes being fully present with someone you love, whether that's putting your phone and your computer away at dinner time, whether that's taking 5 minutes on your transit home to just call someone you love and say, hey, I was thinking about you, just want to see how you are. 5 minutes can do a lot. So being present is important. The second thing in terms of building our connection to our outer circles is actually helping others. And it might seem ironic. You might think, if I'm lonely, don't I need help from other people? But it turns out that when we help others, we actually reaffirm our own value and that we have something to give others. We foster a connection with them that benefits them and us. And then the third piece, which I think is actually probably arguably the most important, building our connection to ourselves, that requires us to love ourselves. What do I mean by this? Well, loving yourself sounds selfish. It sounds like, well, we should focus on everyone else, rather than ourselves. But the truth is, when we don't love and accept ourselves, that's when we start falling into that well that tells us that we are not enough, that we're not valuable. And it becomes hard for us to believe that others would see anything of value within us and want to connect with us as well. And the easiest way I find sometimes to love ourselves is to remember our gifts, is to remember that we spend a lot of time focusing on what we're doing wrong, right? Oh, I should be going to the gym more, I should be eating better, should be spending more time with my kids, I should be doing a better job at work. But what are you actually doing well? What are the gifts that you've been given? I very much believe that every person has been blessed with certain gifts. That might be the ability to make others laugh, the ability to see incisively into an issue, the ability to bring people together in a moment of clarity, the ability to get people excited about a cause. We all have our own gifts. And remembering those, taking a moment to remember those, is what I think we need to do to love ourselves. Love, as I mentioned, is at the heart of addressing loneliness. To me, loneliness is a problem of not being known and not being loved. And if you think about it, and when I reflect on my time in office, one of the most important lessons and insights that came out of it for me was a clear recognition that the world that we're living in is locked in this battle between love on the one side and fear on the other side. And this fear is manifesting as anger and as rage and as jealousy. But love has its own manifestations too, as generosity and kindness and compassion. And the real question is, which way is the balance going to tip in our world? I know for my kids, I want them to live in a world that is powered by love, that's inspired, where people are generous and look out for each other, where we all come together around the big threats and challenges we face, whether that's healthcare or climate change or whatever it might be. That's the world that I want for my kids, a world that's driven by love. But that is going to take each of us to think about how we live lives that are more connected, how we live lives where we both are open to the love of others, but also give of that love in our own way. And if you ever forget the power of love, just remember that love is, in fact, the oldest medicine that we have. It's more powerful than anything else that we have, but we have often forgot about it as we are writing our prescriptions. So just do this for a moment. Take your right hand and just hold it up. I want you to close your eyes for a moment and put your hand over your heart. And for the next 10 seconds, I want you to just think about the people who have loved you over your life. Think about the people who have accepted you for who you are, who have cheered you on in your dark moments, who have believed in you and remembered what you stand for, even when you have forgotten. The people that you can look to who won't judge you, but who love you on your good days and your bad days. And feel the joy and the support and the energy and the love flowing through you as you remember those people. That is the power of love. That is how love heals. And if we commit to living lives that are grounded in love, if we build connections that are powered by love, then I believe that what we can do is we can ultimately create the society that we all dream of. We can create a society that we deserve and one that our kids deserve as well.
Ladies and gentlemen, Vivek, Murthy, thank you.